Good afternoon, everyone. I'm probably keeping you guys from lunch, so hope to keep this interesting for you. We're kind of switching gears a little bit from everything we've been hearing in the morning. We're going to talk about societal impact, right? I am the head of social innovation at Dell. We are a part of the environmental, social, and governance corporate function at Dell, right? What we are trying to do at Dell as the head of global social innovation is leveraging technology, our people, and our global reach to drive societal impact in the areas of education and health, right? This is a social impact initiative. It's a CSR contribution from Dell. We've been working for the last 8 years in India in the public health system. We're partnering with Government of India. And we've taken that experience, we've taken those insights, and we're trying to share that globally. And we're trying to drive similar projects globally on how companies can use their talent, their people, and their expertise, business expertise, to solve large-scale societal problems. So in today's talk, I'm going to provide a little bit of context on digital public infrastructure, which is a very evolving, rapidly transforming field that is going to set the context for the kind of work we're doing in the digital public health system. So first of all, the environment in India is highly conducive to digital health, right? We have a huge digital economy that's being positioned to reach 1 trillion by 2025. The government commitment to health has been to technology. We know about the budget, Atmanirbhar, Digital India. So there's been a huge emphasis on digital in the government's commitment to technology. Government commitment to health is obviously, again, since the pandemic, it's increased. And more so in the recent budget, there's been a huge emphasis on the National Digital Health Platform. And then the newer things that have been happening over the last decade or so, led by Aadhaar, are the digital rails, the digital infrastructure that are creating the foundation for all these transformations to happen. And of course, the very robust, vibrant ecosystem. So this is these are the ingredients that are leading to a very conducive environment for transformational health. Just to go more about this, I want to look specifically at how what India is doing specifically in the area of societal impact, right? We know about, Aadhaar 10 years ago, 1.3 billion digital identities created, but the JAM Trinity, the Jan Dhan Yojana for bank accounts, Aadhaar and mobile, together have been the foundation for direct subsidies, direct transfer of subsidies for people, and that has had a huge impact on so many social programs. UPI, of course, huge success story. One interesting way to position this, we reached a trillion. UPI reached $1 trillion in transaction value this year, and it is more than the combined value, transaction value of China, US, and UK combined. Right? So we've really laid the foundation as a country for some tremendous transformational effort. Now let's go one step further. What is UPI? Right? I want to talk a little bit about digital public infrastructure. So we all understand the way platforms have come into our lives, right? Addressing the problems of fragmentation. Right? I, as a seller, want to sell something. You, as a buyer, want to buy something. Earlier, there was no way to connect us both, right? And platforms came in and addressed that challenge, connecting, buyers and sellers, providers of services and consumers of services. And that led to the whole platform economy, gig economy, aggregators. But they also came with some challenges. And what happened with this? And we're seeing a lot of these challenges play out in front of us, right? Some of the challenges are that the data is concentrated in the platform. the platform has, there is a monopoly of that, of the ecosystem by that platform. The winner takes all, right? They usually end up capturing a lot of the value. And there is privacy issues for the users. All of these have led to a backlash from the providers, from suppliers, from users, right? And that has led to thinking on, is there another way? And this is what India is actually leading the charge in some of this kind of thinking, right? How can we move from centralized platforms to decentralized networks? So if you see on the right-hand side, the whole UPI architecture, which is also, now it's being expanded to a bunch of other sectors. The idea is that if you have protocols that enable the flow of data, that enable interoperability, that enable data portability and sovereignty, then you are not allowing, you're allowing the value to flow through rather than being captured within a platform. You still want platforms because all the innovation happens within the platform. They are the ones who are closest to understanding where there is a gap between a consumer and a supplier and fill those. But by having a set of standard specifications, you're now suddenly allowing anybody to participate in this space, right? And so that these decentralized networks have become the basis for the way we are thinking about value creation and value sharing across multiple sectors. Payments was one. ONDC is the new one that is happening in the e-commerce space, right? So in this context, what is it that's happening in the case of health? Health has the exact same problems, right? You have platforms because you have providers on one side who are the hospitals and pharmacies and anybody who's providing care, and then you have the consumers on the other side, right? And this could be both public and private. And if you are locked into this format of platform with suppliers and providers, obviously again there is data concentration, there is no choice. There is more control. So the Ayushman Bharat digital mission, which started about 3-4 years ago, is looking at how do you move from centralized platform to decentralized network for the health space, right? And there, again, if you can see that we're basically separating out the providers and the consumers or the patients and allowing data to flow across all of them through the network, right? Now, what we are trying to do with Government of India, and that's what the main topic of my talk is, the national NCD system. NCD stands for non-communicable diseases. Think of that as one of the nodes in this large network. And by positioning it in that manner, by integrating with this larger Ayushman Bharat digital mission, we are now able to, we will be able to, as this whole ecosystem builds out, to have the interoperability to connect people throughout the network. And I'll come back to this point at the end. So, what is the National NCD program? Right? NCDs, or non-communicable diseases, are the big disease burden worldwide. Worldwide, countries have gone through an epidemiological transition from your typical, communicable diseases like typhoid, cholera, TB, and all of those, to non-communicable diseases, heart disease, cancers, diabetes. So these have become the new disease burden. You can see 61% of the deaths are caused by NCDs, 4.5 trillion loss to the economy. 3 characteristics that make them very, very difficult and unique. One is they're chronic, right? You have to manage them for life. If you're a diabetic, you're diabetic for life. Second, they're silent. They mostly don't have symptoms, so you only find out when it's fairly advanced stages. And third is non-intuitively, they disproportionately impact the poor because of nutrition, because of environmental conditions, because of poverty, because of a whole bunch of social determinants. So these make it very important for us to be able to tackle it at scale in a preventive manner, not wait for people to get afflicted by the disease and then address it, right? So the Government of India started a population-based screening and treatment and management of non-communicable diseases. This is probably one of the largest programs in the world because it's preventively looking at screening every individual over the age of 30 for 5 diseases: hypertension, diabetes, oral, and breast and cervical cancers for women. Right? This is a massive, really ambitious, really progressive program. And this is, like I said, targeting all the people over the age 30. This was launched about 4 years ago. We are the technology partner. Dell is the technology partner for this as a CSR initiative. Along with Tata Trust, we are partnering with the government of India. So how is this program delivered? And not all of you may be familiar, but India has a very robust government health system. This is multi-tiered. It starts right down at the village level, where you have village-level health workers. That's the bottom part of the pyramid. And then you have trained paramedical nurses at the sub-health center level. And then you have primary centers with doctors. You have hospitals with specialists. And then you have tertiary care centers. And at each level, you also have administrative officials. This entire massive army constitutes the health system, along with health facilities at the primary level, at the sub-health center level, secondary level, district hospitals. This entire thing is the health system, right? Now, any program, any government program for health is delivered through this system, reaching all the way down to people's homes. So in villages, you will find the ASHA worker or the village worker going into people's homes. If a woman is pregnant, if a child needs immunization, and a TB patient needs his medicines, it's a very progressive system, right? But it has its challenges, we all know. I mean, government is trying to do this at a very large scale, under-resourced. So we have created what we call digital life care, a suite of apps and platforms to holistically serve this NCD program, right? So for every one of the steps that you saw in the previous slide, we've created an application. We've created a bunch of productivity tools for the health workers, for the doctors, for the government officials, to be able to deliver their service. Same digital transformation that we're seeing in all our lives in the private sector, same thing we're trying to bring into the public sector for government in the health space, right? So we have mobile apps for the ASHA workers. We have web apps, for the doctors. We have the apps in multiple languages because, people on the ground, the village workers, are obviously not conversant in English, right? There's a threefold objective. What are we trying to do here? A, we want continuum of care for the individual. So what happens is where literacy levels are low and health-seeking behavior is low, people are not thinking about their health as the top priority. They're really looking at their daily job. How do I get the next meal, right? They're not thinking, I have to go and get my preventive checkup done today. So continuum of care for the individual becomes very important. How do you ensure that the poor woman in the village actually, if she is screen positive, actually follows through that whole journey? And not just taking her medicines once, but actually continuing it, month after month, year after year. This continuum of care is really important, and technology can play a huge role in helping that, right? By helping the health worker track actually which individual has which visit, when, which one is overdue, who hasn't made it. So those are the kind of tools that we're giving her. Second, productivity and quality for the care providers. You saw that whole big army of care providers, right? More than 1 million health workers, doctors. Now, they are all catering to a huge population. One health worker has 5,000 people that she needs to follow up with. Giving her the tools to enable, to see her targets, what she needs to do, what is her plan for this week, who are the people she needs to follow up with, helps increase her productivity. So that's a very important tool, and alerts and reminders. This person hasn't met their, had their visit, right? So those alerts and reminders and messages, all of that make it very easy for her to do her job. The third is for the people who are running these programs, right? It could be a district and block level official, it could be state level health officials, or people at the center, the bureaucrats, the nodal officers, the government, health institutions. For them, the tools that they can use, real-time dashboards, to be able to make decisions. So this is the threefold objective of the system. It's all sitting on a cloud platform. There's a health ID and a health record for every individual, and we started this as an innovation idea in 2013. saying, how can we use technology to address societal needs, right? How do we do something where we give back to society and do something to address those problems? So we started this as an idea. We did a pilot. First, we co-created it with an NGO right here in Karnataka called Karuna Trust. We did the next level. We took it to Andhra. We worked at a whole district with the government of Andhra Pradesh, then worked with Telangana. And since 2018, when the Prime Minister launched it, we've been a part of the Ayushman Bharat program. We've had, in 2019, we had 100,000 enrollments. 2020, it went up to 45 million. March of 21, we had 100 million. And as of January of this year, we have 135 million people enrolled in the system. It's running in 33 states. It's being used across 593 districts with 94,000 plus health workers and officials trained to use it, and 135K users, right? So this is the spread of this system that we've been, Dell and Tata Trust as partners have been working together since 2015 and working with the government of India and a whole ecosystem of partners. That's the important takeaway, right? That this is not a Dell program, this is not a Tata Trust program, this is a government of India program. And the end-to-end implementation, starting, technology is one part of it, right? But the entire system has to kick in to make this work. And this end-to-end implementation, even of the technology, happens with a whole ecosystem of partners, primarily Ministry of Health and Family Welfare, and then we work with the All India Institute of Medical Sciences, with the World Health Organization, the National Health System Resource Center, and then we work with a bunch of ICMR institutions. Harvard is doing an optimization study. So we work with the National Health Authority, which runs the Ayushman Bharat, the digital mission. So we work with all the ecosystem partners here to design, develop, deploy, and run this system across India. So a couple of things I want to say. I was asked to share our lessons, right? What are the insights that we have? Because we are now looking at my work in Dell for social innovation is based on the work that we've done in India, learning how to work with the system. What are the lessons that we can take to other countries, right? So the first is that when you're trying to do something for societal impact, you have to immerse yourself really, really deeply into the domain. In this case, for us, the domain involved understanding how the government system works, right? In all its glory, right from the field all the way to the center, right? It involves understanding public health. What are the social determinants of health, right? What makes people do certain things, and the social determinants, the behavioral changes. About non-communicable diseases, because this is a program for non-communicable diseases. So you have to understand all of that in that context before you step in there with a technology solution. The second is you have to work across, you have to straddle all the levels. You have to be, working with Government of India on policy, on plans, on budgets, and the program design, working with the states on administering and helping them, when they are running campaigns, when they're running these programs, working at the state level, working with district and block officials who are doing the daily monitoring and management, and with the health workers and doctors on the ground. We actually sit with them. You can see some of those pictures. We actually sit with them and learn, understand their issues. We've tracked them, we've followed them. I've trained more than 500, me and my team have trained more than 500, 600 health workers ourselves. But you need to be able to span across all of this. And you need to design your technology in a way that makes sense for the rural context. It has to work offline when there's no internet connectivity. It has to be in local languages. You have to really listen and understand in that context what would make sense, right? And so that is a very iterative process that we keep going back and forth on. And finally, making sure that, I want to go back to the slide on the decentralized networks. One of the problems that we see is that there are many such software systems within government, right? And we're running into the same problem of interoperability. And by plugging into the Ayushman Bharat digital mission, the decentralized network, and we are in the process of completing our integration, Suddenly, the system is then able to talk to other systems within the government health space and even in the private space, whether it is reproductive child health, TB, each of these has their own IT systems. But by plugging into this Ayushman Bharat digital mission, the decentralized networks, through the open protocols and interoperability, suddenly you get a much broader, interoperable, open system that can talk to all of the others. And the end goal, of course, is to make sure that the individual, our citizens, our fellow brothers and sisters on the ground can get access to good quality healthcare. Thank you.